For this video, we'll be looking at human and plastic skulls. We'll be doing the features of 3 of the skull bones. So if you get out your blue bone packet, we'll be doing the frontal bone, parietal bone, and occipital bone. So we're going to start with the supraorbital foramen, or notch.
Here in front,
That's a supraorbital foramen
here's the notch.
On a human skull.
Right.
Next, we'll be looking at the frontal sinus. A sinus is a cavity within a bone, so you would have to open the frontal bone in order to see this frontal sinus within it. All right. We'll be looking at the frontal crest.
Crest is on the inside here of the frontal bone on the plastic, and then you can see it better on the human skull.
Frontal crest.
Frontal crest.
All right. The coronal suture is the suture between the parietal and the frontal bone.
Here.
All right. This frontal bone forms part of the anterior cranial fossa.
Anterior cranial fossa, and there are 3. Here's the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. But we're going to focus here for the frontal bone on the anterior cranial fossa.
All right, we'll now move on to the parietal bone. The parietal bone features are 4 sutures. So we'll look at the sagittal suture,
Sagittal suture.
which is between the 2 parietal bones, the coronal suture,
Coronal.
between the frontal and parietal bone, the lambdoid suture, between the parietal bones and the occipital bone, and the squamous suture, between the parietal bone and the temporal bone. Then move on to the occipital bone, and we see the posterior cranial fossa,
Posterior cranial fossa.
which is largely the occipital bone. It has the foramen magnum,
Foramen magnum.
the occipital condyles,
Occipital condyles here, the inferior portion of the occipital bone, and these are just little. They almost feel like knuckles, and they articulate with C1 of the vertebrae.
there's the hypoglossal canal,
Hypoglossal canal is right above the occipital condyles.
and there is the external occipital protuberance,
There we go.
and on either side of it are the superior
Superior,
nuchal lines, and below it the inferior nuchal line
inferior,
and the medial nuchal line.
medial.